Commiskey in Albuquerque, New Mexico. This is cataract surgery and a DSAEK partial thickness cornea transplant in a patient who has a tube shunt where the tube has contributed to the failure of the corneal endothelium. It's sort of a long-standing issue, so there's some amount of haze that you can see on the left side of the video in the cornea that we're sort of hoping resolves a little bit with the corneal transplant. Of course, if that haze or scar stays in the stroma of the cornea, and the patient needs better vision, then a full thickness cornea transplant would be the other option for them. There I removed the epithelium to try to get a little bit of a better view for our cataract surgery here. And as you'll see, the visualization is a challenge here, so I'll kind of modify my usual technique accordingly. Here I'm sitting at the head of the bed superiorly, with the patient sort of in front of me rather than my usual position at the side. So here I make the groove and crack, but as you can see, it's really kind of a tough view. So I'm able to kind of crack into some quadrants, but really want to make sure that I'm not becoming involved with the capsule. And so I decided to just pop up the cataract out of the capsular bag. After all, we're replacing the endothelium, so perhaps I'll do a little bit of the cataract surgery a little bit more anterior and for safety's sake, just stay away from the capsular bag. So cataract goes away pretty quickly. And at this point, we're just going to do the cortical cleanup there and then get ready to put a intraocular lens in. So this is the kind of complicated surgery that often takes place at a university. And one of the things I love about working at Eye Associates is that we can take care of patients in a private practice in a manner that you would normally care for them at a university setting. And so that's very rewarding for many of us that work here. So the lens is in, and then what I'm doing there is just stripping the endothelium. For the partial thickness cornea transplant, you have to take off the patient's own cornea endothelium. Then here I'm using a pair of forceps and an intraocular scissor to remove the tip of that tube that I think was protruding just a little bit too much, causing that decompensation there in the cornea. So they're just removing all the viscoelastic that is left over there. You can tell there's quite a bit of movement, The patient, even though we've given a lot of relaxing medicine, does have restless leg syndrome where the legs just have a mind of their own and are just moving and moving. And as we often say in the operating room, the leg bone is connected to the eye bone, or something like that. So you see our patient is moving quite a bit, and that movement is pronounced, in this sped up video. This is the Endoglide, which is a delivery device for the DSAEK. I use this Descemet forceps developed by Dr. John at the Wilmer Eye, and now he's at the University of Virginia. But it's a wonderful instrument to pull the DSAEK through. So here I'm spinning it around a bit to confirm its orientation, and I actually pulled it in upside down. There's a little S mark there. So I'm going to use that same Descemet forceps to grasp the tissue and to make it right side up. There's a bit of infusion there. I'm providing with that other instrument there. We're able to flip the graft over. So we're coming toward the end of the surgery where we just make sure the graft is well centered and that there's a good air bubble. Here the graft is positioned a little bit inferiorly. With the patients that have a tube shunt, we want to make sure there's a really thorough air fill, because the uh, bubble tends to go away quickly. There was a little maneuver with the suture just to bring the graft centrally, and so now you can see it's well centered, and I'm just going to put a suture at that 2.75 millimeter incision to keep everything nice and sealed up, and I think I'll give it one more puff of air. We have these patients positioned for about an hour in our surgery center before they go home and continue to position at home. So, thanks for watching this more complicated surgery. Thanks.